dear viewers, we have been joined in the studio by our first guest for this evening, Dr. Anas Aledan, the Senior Registrar and Internal Medicine Specialist at Mubarak Al Kabir Hospital. Medical and health education, of course, can lead to prevention of many undesirable diseases. Of course, we're going to discuss all of these issues thoroughly with our guests. It's a pleasure to have you with us today.
Thank you so much for inviting me.
Thank you. To start off, can you tell us about yourself?
Okay, my name is Dr. Anas Aledan. I work as a senior registrar in Mubarak Al Kabir Hospital, Ministry of Health. I am a graduate from Kuwait University in 2010, and I hold the degree of the Kuwaiti Board of Internal Medicine issued by the Kuwait Institute of Medical Specialization in 2017. Currently, I'm specializing, doing my subspecialty shortly in rheumatology, subspecialty of internal medicine.
That's amazing. So today we're going to be talking about health education.
Yeah.
What is health promotion in general?
Okay, so to start with, what is health promotion? Health promotion is the process of enabling people to control over and improve their health. Now, how could people achieve that? By many ways. By stop the bad health habits, the bad habits, smoking, not doing exercise, and so on. On the other hand, is to promote their health by taking like medical advices and eating well and following a healthy diet system, and a lot of actions actually that they can do to maintain their health in terms of that. Yeah.
So we can say even before going to a doctor or visiting a clinic, there's so many things someone can do to achieve a better lifestyle and like prevent so many diseases.
Correct. That is absolutely right. A lot of things. Now, most of the world governments are investing on health promotion and disease prevention because the cost of health promotion and disease prevention is much lower than diagnosing and treating diseases. So, in fact of this view, it is quite important on modern medicine to invest on this field specifically to prevent disease from occurring to individuals. So it is quite important, I would say, to invest on health promotion and disease prevention.
Yes, of course, because preventing it would be better than having to deal with the actual issue. And as you said, it even costs less.
Absolutely
which is
right.
amazing.
Absolutely
How can we increase health education today?
Now, there are many ways that we can increase the health education. One of it is the electronic campaigns through the social media accounts. Now, we're living in the social media era, and it is the new era of tech. So, using this power and powerful instrument, investing it to educate people is quite challenging and quite doable. I mean, because it can reach the people, you see, very easily, in which they can get the medical information, they can get the medical knowledge on how they promote their health and to prevent diseases. And if a person have like symptoms and he knows that these symptoms could be related to that disease, he may go to his treating physician and ask for a medical consultation. So probably he will be diagnosed earlier in that disease and having like treatment. Exactly, exactly.
So do you think social media campaigns, let's say, or even prevention through doctors talking on social media, is that better than having a legit traditional campaign or even just these brochures that are available in hospitals and clinics?
I mean, the social media is approachable to I would say, hundreds of thousands. So it is an easy tool and a very powerful one, and reaching all the age groups. So I would say it is quite more powerful instrument, and it should be invested in modern medicine, in health promotion and disease prevention campaigns.
Of course, social media is now part of our everyday lives and lifestyle. We like it or not. So we're going to talk more about social media and the medical field in a bit. But can we talk about disease prevention?
Yes. Now, how we can prevent diseases? Of course, prevent diseases is through screening, maintaining a healthy life habit, and seeking attention, from medical expertise whenever is needed. Now, there are many ways how we can prevent diseases from happening. Unfortunately, and I'm sad to say this, that we have a good number, a high number actually, of obesity and smoking, and these numbers should go down, because these two factors play a major risk on people's health, and they need to be controlled over by anyhow. So I would say preventing diseases is a multidisciplinary approach, in which there is a governmental role in it, and of course the society role in it, and combining the two segments together would yield a very amazing results, I would say.
I can only imagine. And as you said, obesity is an issue we have been dealing with for years. I think in Kuwait we're one of the top,
unfortunately,
in obesity. So I think, yes, some disease prevention would be amazing in this case.
Yep.
So what should we do in terms of preventing diseases? What can we do as individuals at home?
All right. So at home, maintaining a healthy lifestyle, exercising, stop smoking, going for like a regular checkup and screening. Now, there are a lot of screening programs throughout the country. Like for women, we have the mammogram, for the breast cancer campaigns, the prostate cancer campaigns for the men, and of course the colonoscopy, which is the procedure done to screen for colon cancer, which is really numbers are getting higher and higher year after another. So we need to screen our people after the age of 50 in regard to colon cancer. So by all these actions, I think individuals would be of great pattern of maintaining their health. Yeah.
So we're talking about social media. How are you seeing the social media when it comes to the medical field? Is it being put to use enough, or do they really need to use this tool that they have under their disposal?
Now, as any tool or instrument, the social media is a two-phase weapon. It can be used like in a good way, and it can be used in a bad way. Now, it can be used in a good way once it is used for health awareness.
Yes.
In terms of health promotion and disease prevention. However, if it is used as a clinical and electronic clinics in which people seek consults from medical advice from those, I would say that this is a catastrophe, and this is completely not acceptable, because the medical diagnosis needs a clinical exam, and needs taking a history, being with the clinician in the clinic. So it is completely unacceptable that any person seek any medical opinion through an electronic account, and I always say this to people, that there is a big difference between the health awareness and a medical consultation.
It's completely different.
It's completely
different. Just some symptoms that a patient is seeing, it's not great for Instagram to just contact a doctor. You are someone that's using Instagram in the best way possible to put out some facts and awareness out there. Can you talk to us about your account, Zwara Tebeya?
Yes, definitely. Actually, this account was established on last July, I would say, and its main aim was health awareness, electronic health awareness. Zwara Tebeya, in which we go and visit the doctor, and he gives us a talk about a medical topic, or like a health issue, educating people about the stuff or any medical stuff, and give a piece of advices to people. However, no medical consultations.
Of course.
And some people are even asking through the account if I have these symptoms, but they are not unanswered. I mean, they should go to the clinic, really. It is just
Yes.
a one-way approach, and to people for health promotion and disease prevention, health awareness.
I'm actually very glad that you have mentioned this today, because I'm someone that meets a lot of people during my day, and unfortunately it is true, people are seeking medical consultations online and even going through photos of before and afters of things and actually going to a clinic. So I'm glad you mentioned this. Doctor, do you have any final words or advice you can give our viewers today?
I would say never seek an electronic medical opinion again.
Yes.
Always follow, if you have symptoms, go to your treating physician. And before taking any medication that has been pronounced upon the social media, just go and ask your treating physician and pharmacist. Don't take things by your own or based on a commercial that you see on the social media.
Exactly. Thank you so much for all the advice and important information you gave us today.
Welcome.
It was a pleasure. We had with us Dr. Anas Al-Eidan, the Senior Registrar and Internal Medicine Specialist at Mubarak Al-Kabir Hospital. And now we're going to cut to a report on the press conference for the Gulf Week for Cancer Awareness. Stay tuned.